Welcome to Growing Belleville Through Community Chats, a podcast presented by the Greater Belleville Chamber of Commerce to help highlight, promote, and enlighten people, businesses, and community events in the Greater Belleville Area. Here are your hosts, Stephen Sedlak and Eric Huber.
Everybody, welcome back to another edition of Growing Belleville Through Community Chats. I am your co-host, Stephen Sedlak, along with the incomparable Mr. Eric Huber. How are we, Eric?
I'm doing well, Stephen, doing well. We shout out to the Chamber. I'm not sure when we'll air this, but obviously you and I, we attended the Chamber's 100th anniversary.
Yes.
They had a
beautiful night.
Turned out to be a great night in the middle of all these storms we got rolling in. It was a beautiful night. We had beautiful speakers. We had some winners out there. As we mentioned, we did
not us.
We did not win the Citizens of the Year, which I am shocked. So,
yeah, I had my speech prepared and everything. You know, what a shame.
Absolutely, but no, congrats to the Chamber, obviously.
I agree. I remember when Wendy came to us board members with this idea and the time frame that she said it was in May, and I know the golf tournaments in May sometimes, and that's always sketchy. And, kudos to her. It was quite an event just to have that huge table in downtown Belleville, just everything blocked off. Downtown is such a huge part of this community, and I do it there and just bring everybody together. It was just an awesome time.
Yeah.
Now, Eric, did you go out afterwards? Are you feeling a little rough this morning, or did you call it an early night?
No, we were planning on going to Benny's, and then I had, the 2 flower arrangements taken to the car. On the way to the car, I immediately turned a left turn, and I was like, let's head home. And I was at the gym at 5 a.m. this morning, so I was good.
Smart man. Yeah, I brought my flowers over to my wife, too, since she couldn't make it. So anyway, our guest today, after our little ramble here, is Katie Rybak with Embody Her Health. How are you, Katie?
Great. Thank you for asking.
Well, if you don't mind, why don't you just go ahead and kind of introduce yourself for those that don't know you?
Sure. So, my name is Katie Rybak, and I actually grew up here in Belleville. So I've been a Belleville resident my whole life, attended Althoff Catholic, went away for college and medical school, and came back to the area once I graduated medical school to practice as a doctor. And I opened my own clinic 1 year ago. We're coming up on 1 year, May 25th. Will be our 1 year anniversary with our new clinic, Embody Her Health.
I guess I should preface this. It's Dr. Katie Rybak. That's I want to make sure that's out there.
I'm a doctor, but you can certainly call me Katie. That is completely fine.
Well, no. If you have the designation, I definitely want to call you, pronounce you by that. So anyway, so what was it that made you kind of decide to come back to Belleville area and kind of open up your practice here?
Yeah, so my husband and I are both from Illinois, from Southern Illinois, and both of our families still live here. My brothers both live here, my mom and dad. His parents and his family lives over in St. Louis now in the Webster area, so we really wanted to raise our family, our kiddos close to cousins, grandparents, all of those good things. I grew up, my father was a physician in the community as well, so I grew up in that medical environment and loved how the community treats, their physicians and vice versa. The patients really are wonderful here. So I wanted to have that community vibe that I grew up hearing about. When I came back, I didn't open my practice immediately. I worked for other entities prior to opening my practice. I worked for different places before that. And then I decided I really want to do things a different way and do them my own way and really have a very structured experience. I've been a doctor now since 2008 is when I graduated medical school. So I've had a lot of experience in the hospital setting and clinic setting, nursing homes. I really wanted to wrap all that together into looking at women's wellness and longevity and really wrapping that all into one big package.
Yeah, I think there's something to be said about the Belleville area, about how it does just draw people back in one way or another, whether you live here or, I myself live over in Webster, but I work here every day. I still commute back this way. There's just something about it, and you grow up in this community and you're still driven and drawn to it in one way or another.
Absolutely agreed.
So now you're just past a year, correct, of your new practice?
May 25th will be
May 25th is coming up on
our anniversary. So yeah, it's coming up here in a few weeks. So we're really proud of that. We've really been growing so quickly, and it's been such an amazing experience for everybody.
Well, that's what I was going to ask. How's that first year been? I know it can be fun, scary. I mean, all those emotions torn into one.
All of the things. But I mean, overall, I couldn't be more proud and more satisfied and assured that I made the right decision. It's a big decision to leave a practice and do this. And as doctors, we're not trained well in the business world. Right. So it's something I was very unsure how this was going to go down and how I was going to be able to manage this. But I'm really proud of how I've been able to do that. I've had really great connections that have helped me as well. My good friend Amy Stuttle is the CEO of Victory Men's Health. So she's really helped guide me in a lot of these different business aspects because it is all brand new to me. I don't have a master's in business. I don't have any background in business, but it's been really exciting and I've really learned a lot in a year and it's been going great. So I'm very excited about it.
Well, kudos to you. It's not an easy task to get that first year. And you know, you're not alone. There's a lot of people that go into business that don't have the business, background per se, you know, whether they were in a sales role and then realize that they want to go out on their own or take over a business that way. So there is a lot of learning on the job, if you will. So kudos to you.
Absolutely agreed. And one thing I identified, my previous practices and working as a physician in other places was I really wanted happy employees. I wanted people that want to come to work, are passionate about what they do, are reimbursed well, are being, satisfied in their goals, both personally and professionally. So it was really key to me that I had a team around me that is, all on board and all supportive of what we do and passionate in their own right about what we do at the clinic here. So that was a really big part for me because having a good team is everything. You can't do this alone.
For sure.
Now, Katie, well, first off, Stephen, I think this is 2024's turned into a year of Altoff. I mean, we've had Kevin Lish, Coach Lee.
And yeah,
Coach Lee was just on. We got Katie. So we'll keep this going. I like this trend here with Altoff.
There you go.
Either Altoff alums or anything, but
100. Yeah.
Katie, you mentioned it. You were kind of in that day-to-day grind, right? Probably the same day, same thing, over and over, repeat. And obviously, there's people out there that are probably in that same kind of mindset or same situation, and maybe they are thinking about going off on their own, starting their own business, like Stephen said. I'm sure the emotions are all over the place. You mentioned Amy, how pivotal or even maybe how long was that process when you reached out to her and really started those conversations from day one to opening day? Kind of how long did that take? How long did you have that, did it take for the confidence to be like, okay, let's do this?
Sure. So when I originally talked to Amy, we've been friends for years. So I always knew about her clinic, went to her clinic myself, supported everything she was doing. But I always noticed you do all the guy stuff, but why not the female part of things? So I really approached it at first with Amy as more, why don't you open a women's clinic and I will manage it. I'm really passionate about these things personally. I want more time with my patients. I want to approach longevity more, have no time in my previous clinic. And she really was a big part of getting me to see outside of the box and be like, how about you open the clinic and I will help and guide you, but you can do this on your own. You can do this. You don't need me. So as far as being like under her completely. So that was a really different switch. And then I really decided, pretty quickly, we had some, personal things happen in our clinic at the time that I was working at that I knew it was time to leave. So I gave my notice. When you give a notice as a physician, you usually actually have 3 to 6 months before you're able to actually leave. And then you have a non-compete clause after that where you're not able to practice within a certain radius for a certain amount of time. So I had a time period, where I really had to just, focus and dedicate to planning this clinic. And that was really 12 months solid where I was able to get the organization going, find the right space, start finding the right team. I knew I need to have a great nurse practitioner, a great receptionist, a great patient care coordinator. So I had to have all these different pieces in place. So it was a solid year of really that organization and getting the clinic doors actually opened. So it was, a very long process, a lot of time involved in that. I definitely approached it thinking it was going to be, a cakewalk, as a doctor. And, residency is one of the hardest times of your life. You're working 100 hours a week, you never sleep, crazy times. Like, if I did that, I can do this, this will be fine. And it was much more of a demanding and stressful year than I ever imagined. But
Right.
but it was definitely able, I was able to get those pieces in place and really feel confident about my decisions, take my time, find the right employees, find the right team, and really felt confident the day we opened that this is all good. This is going to work.
Yeah, and I think part of that, the stress, and I'm sure you would agree with me here, is that when you're putting together and you're finding the right people, right, to join you as in your staff, you start to realize that it's not just about your livelihood that's on the line here. It's them taking the leap with you and their livelihood. And that kind of stress it's good and bad in its own way, because it's kind of that monkey on your back a little bit.
100%. Yes.
Yeah.
My good friend Amanda Eversgerd, she's a nurse practitioner, and I knew when I wanted to do this clinic, I knew Amanda's a person, right? That was obvious to me. And I knew if she's not going to do this, I'm not doing it. So I laid it all out there. I'm like, I know you've got a great job. I know you love it. I know this is a huge leap of faith and risk, but I really think we're going to love this, and this is going to be for us. And she trusted that. And really, yeah, but there's a lot of pressure, because she's leaving a job, and she's trusting that this is going to be her replacement job now. This will be the long haul and the long-term plan. But things can go different ways, especially the first year. So she definitely took a big leap of faith with that. Absolutely.
Well, kudos to you. Like I said, sometimes you just got to take that leap. And if you don't, you'll never know, and you always wonder, right?
Absolutely.
What was it? I know you kind of touched a little bit on it, but what was it? You said you have such a diverse background of what you've done in the medical field previously. And then what was it, I guess, that at some point decided just to embody, just to focus on the where you're at now?
Yeah, really great question. So I'm an internal medicine physician by trade. And in the clinic setting I was in before, it's really busy. You're seeing lots of variety of different things, and people are very sick. So you're seeing sick people in a very short amount of time, and having to really, try to get as much as you can into a 5 or 10 minute appointment. And it's really challenging. So, and my focuses are always, I love the people that are incredibly healthy already and want to optimize that and live long and live well. And it was getting a little bit grinding and, just really bearing down on me that a lot of these patients are super sick, and they really weren't wanting to do anything differently. And I'm wasting a lot of my efforts and time, so to speak, on that, when there's people that really are wanting to optimize. They want to feel better. They're in their 40s. They're sick. They're tired all the time, but they don't know why. I didn't have the time to really figure it out. And then on a personal note, I went through some experiences myself in the healthcare world where I actually got diagnosed with several autoimmune diseases that really kind of gave me a different patient perspective of things that I'd never had before. And realizing that, it's hard even as a doctor to find good quality care and have a physician listen to you and spend time with you and dig into it and really see what else you can do to optimize your health. And I also ended up going through menopause early because of my autoimmune diseases. So I started seeing medicine in a completely different light, and my patients in a completely different light, and being like, wow, all these 35 to 50-year-old women that just don't feel good and nobody knows why. There's some reasons why, and I need to really help them find those reasons why. So I think from a kind of selfish personal perspective, that became my big instigating factor with this. And then having, that rewarding feeling when women do get good responses and we do help them feel better and find out what else could be going on with their health, it's been so rewarding. So a lot of personal experience behind that from both that patient perspective and the doctor listening perspective, patients not feeling well.
Absolutely. That's awesome. No, I get where you're coming from. Probably that personal experience, obviously, as you mentioned, when you kind of sit in your patient's seat, probably it turns your perspective around a little bit on, okay, what am I doing and how can I better everyone's situation? So I'm sure that was a big reason. So onto that, for people who don't know Embody Her Health, what can they expect? What do you guys do? What do you guys help with? that you kind of touched on a little bit, but what can a female going into your place expect when they see your guys' faces?
Sure. So our big focus is on helping women feel their best for the longest amount of time, that we have here on this planet. So we're wellness focused. Hormone replacement is a really big focus of what we do. Weight loss is a big focus of what we do. We do a lot of specialty testing to look into deficiencies in micronutrients and food sensitivities. We focus a lot on lifestyle. I found in my previous practice, it's really hard to get into the nitty-gritties of people's lifestyles and how they eat, how they approach their activity level, their sleep level. So we really delve into all those different factors. So while we love hormones, it is a big part of longevity and living longer. That's not all we do. We can, if women are not wanting that part of, their facets approach, that's okay. We have other ways to really optimize health, with the focus being longevity, living really well into our 80s, 90s. I mean, even 100 is really our big goal.
Yeah, and I would think, probably as you mentioned, previous life, it was probably patients in and out, right? Would you say you guys, I'm assuming, spend what you've just described, you probably spending a lot more time with these patients, a lot of more one-on-one, which I would assume is what you enjoy more.
So we have solid 60-minute appointments with our new patients. So a lot of face, and it's with the provider. So a lot of face-to-face time right off the bat to give kind of perspective. My previous would be maybe 20 minutes, once you get in the actual door after vitals are taken, everything's checked, 20 minutes of face-to-face time for a new patient appointment, which, I mean, you can barely scratch the surface. So now with 60, I mean, there's still a lot of work to be done. We still have a lot of follow-up appointments to talk about more things. But at least in 60, when I'm focusing on wellness, I can really, focus on lifestyle and what makes this person tick. What do they do day to day? What time do they get up? Time do they go to bed? How should they change these things? Looking at all of their labs. We do a huge lab panel that we have in the first visit. So we really look at all the different, parts of their health and approach it from an overall wellness perspective.
So you guys take a deep dive right from the beginning, basically.
We do. Absolutely, we do. And we give, really some more opinion too, because a lot of times some of these patients have been seeing their same provider for years and years, and they're just on medications. They don't really know why, and they don't know why they should or shouldn't do this procedure or surgery. And they want to hear from somebody else. Like, is this something I should be on? Is this something I should be doing, etc.? We try to really help give that time and guidance on those different topics and give literature. I'm all about evidence-based medicine and reading this article and learning why you're doing the things you're doing, not just blindly taking things just because somebody on the internet told you to. Like, actually know why you're on this supplement or why you're taking this prescription medication, what it's doing to your body. That's really important to me, that women are autonomous and learning about their own health and not just blindly doing things because somebody told them to.
Do you, because it kind of seems like you take more of a relationship kind of approach to it in essence than previously you had. Do you kind of feel now that people are more open in discussing these things with you than maybe in the previous roles you were at, because it is more relationship based? You are, they're feeling a little more comfortable with you. Let's be honest, I go to the doctor, they'll ask me questions that, whatever. I'll tell them what they want to hear and move on because I don't think it's a big deal. I'm not going to lie. I'm sure I'm not the only guy out there that does that.
I was going to say 60 minutes with a doctor. That's probably the last 6 years of total combined visit.
Right. So anyway, do you kind of feel like it's a different client relationship approach, if you will?
Absolutely. We really, there's nothing women can tell us that we are uncomfortable with. We do a lot of sexual wellness, and that's something that we, in my previous practice, I don't have time. That's not a priority when you have diabetes, hypertension, all these check boxes for insurance. But this is a priority in women's lives for a lot of women. And so it is something that we keep it we are very open. Ask us any question. We will try to help you with any problem you have, because quality of life is everything. If you're not living well and doing all the things you want to do with your life, it's hard. It makes every day just not as enjoyable as it should be. So yes, very, personal relationships. Our patients tell us a lot of things they don't feel comfortable telling their other providers about. So we really pride ourselves on that.
Okay, you mentioned a little bit on wellness. I know you guys have kind of a big event, I would think, coming up here in June, right? Kind of a main wellness. Why don't you touch on that a little bit?
Yes, thank you. So June 9th, we're going to have a party, so to speak, where we're going to have women's wellness as the focus of the topic. We're going to be asking our social media followers to give us some questions that they're curious about. And me and Amanda and Melissa, my patient care coordinator, will be fielding those questions in person. We're going to keep it pretty intimate, actually, closer to 10 to 12 people. So it's going to be a first come, first serve kind of situation where they sign up for this. It's free. There's no charge for this. And we're really trying to get women that are curious what we do and just have questions and want to hear more about women's wellness, have resources. We know who the good, resources are out there, the good doctors to follow, the good books to read. So really sharing that information in a more intimate platform with, a more, 10 to 12 women to really get those answers answered in real time. So, and we do plan to do that via webinar also, so women can also log in and be able to see it from home. But we encourage women and, to come in and sign up as quickly as they can, because we're only going to do a small amount for this first round. And we anticipate being able to do these events, pretty frequently to really be able to field those questions and get out into the community resources for our patients.
Awesome. Well, what's a good way for people to get more information on that, or just to get more information, about you guys?
Sure. So our Instagram, we have a wonderful Instagram page that my marketing director, Dawn Kurtz, runs. So Embody Her Health is our Instagram, and our Facebook is the same. Our website is embodyherhealth.com, and that's EMBODY, her health. And then people are always welcome to call. Our phone number is actually HIPAA compliant. So patients, future patients, can actually text us on that phone number or call as well to ask questions. We're very responsive here. We really pride ourselves on that too, is really responding quickly to women and patients' questions. But they can call us too. So 618-680-1177 is our phone number.
Well, Eric, you got anything else?
No, Katie, it was a pleasure having you on, and everyone out there, if you haven't stopped by, they got a beautiful place on Frank Scott Parkway there with Pier 111. So if you aren't familiar where they're at, that's where they're at. So stop in. They got a great team.
Awesome.
Thank you, Eric. And thank you, Stephen.
Yes, thank you for joining us. We truly appreciate it. So, all righty, everybody have a good day. And again, we appreciate you hopping on with us.
Thank you.
Thanks, guys.
Thanks for listening to another episode of the Growing Belleville Through Community Chats podcast. Please remember to follow and subscribe to this podcast and share with your friends and community leaders. For additional information from this podcast, please reach out to the Greater Belleville Chamber of Commerce.